Hello, my name is Peter McCormick, physiotherapist, Accident Emergency Department, Altnagelvin Hospital. Thanks for taking the time to watch our video today. We've created this to help you in your recovery from ankle sprain. Today what we're going to talk about are things such as what is an ankle sprain, what are the typical problems that ankle sprain produce for patients, how we can manage them, and what we can do in the future to try and help minimize these problems. So ankle sprains usually occur as a result of overturning onto the outer aspect of your foot, or in some cases this can result as this action here where your foot's been moved down and turned in on itself with your body weight rolling over the top of it. We can see on the model here, this is the outer aspect of the ankle, and it's these structures towards the outer aspect of the ankle which are most susceptible to injury. This is Kevin, and he's kindly agreed to be our model for today. And we've marked on Kevin's ankle the areas of the ankle which are often susceptible to injury. These areas marked in black are the ligaments on the outer aspect of the ankle. And in most cases, it tends to be this one towards the front, which is often injured. As a result of ankle sprain and that forced stress of the foot downwards and inwards, the ligaments in the outer aspect of the ankle and some of the soft tissue, including the muscles, can be overstretched. The effect of this is causing the patient pain, swelling, loss of strength, loss of function, loss of balance control, and also difficulty with things like walking. So in order to minimise the problems that we've already spoken about that ankle sprains can cause, i.e. pain, swelling, difficulty with walking, there's some early advice that we want you to put into practice. Firstly, try and avoid adding any heat to the area. This will only add to the swelling and add to your pain. Alcohol in the first 72 hours after soft tissue injuries tends to increase the amount of inflammatory hormones in our blood and will also add to pain. Running or vigorous exercise after an acute injury like an ankle sprain is obviously going to add to pain levels and swelling. Finally, massage in early stages after injury will not help recovery and will probably add to pain levels and damage any early healing that's starting to take place. Other basic advice in the early stages after injury includes protection. Protection can take the form of maybe crutches for those people who are unable to walk properly after injury, or protection can also mean taking a step or two back from your normal day-to-day activities to allow the area to come round before we resume normal activities again. Elevation works well for helping to control swelling in the early stages after injury. This involves making sure, in the case of the ankle is higher than the knee and the knee is higher than the hip, and we'll show you an example of this in a second. Also some compression, for instance an elasticated support bandage over the area can also help to work well in reducing swelling. It's important to note at this stage that these kinds of compression garments are not worn in bed at night. So Kevin here is demonstrating the typical position that a patient might get into in the first 2-3 days after ankle sprain. Lying up in the bed regularly throughout the day, getting his ankle elevated. Okay, in this case we can see his ankles above his knee and his knees above his hip. And this allows what I call the drain pipe effect for swelling to track down to the back of the knee or to the groin where it will be absorbed and dispersed. And obviously that will have a positive effect on pain. We can see here Kevin's got his elasticated support bandage on from foot to just below his knee, okay, again which he removes when going to bed, and he wears this throughout the day. In this position Kevin can also start a bit of gentle basic movement at his ankle, getting the ankle pump going, and again this also helps to disperse some swelling. So these are the basic exercises that I instruct patients on after ankle sprain. So first of all, Kevin, what we'll do, we'll get you to form the alphabet with your foot. What I tend to say to patients is make your big toe your pencil tip, and starting from A, B, C, D, you're going through all the letters of the alphabet, maybe doing a couple of sets of that, and doing that regularly through the day to try and regain ankle movement back after your injury. It is okay to feel a bit of slight discomfort with this, but it's not excruciating pain. Okay. Other simple exercises at this stage might be just getting you to roll up onto your toes and up onto your heels in a sitting position. It's important as well at this stage to start some early strengthening, and by simply using the resistance of your own hand, you can push your foot down against the pressure of your hand, probably less than 30% effort initially. Pushing foot down against my hand. Okay, one cancels the other out. Trying to pull my foot up against my hand. Trying to push my foot in against my hand, and trying to turn my foot out against my hand the other way. Okay, hold in each position for about 5 seconds, and again maybe 5 to 10 exercises in each direction, again regularly through the day. One of the last important exercises that I would encourage at this stage is a simple stretch for your ankle. If we can get you lying again, Kevin. Even by using a simple towel, Kevin, what we're going to get you to do is we're going to get you to wrap this around your foot, okay? And if you can just draw your foot towards you, okay? And that provides a bit of a basic stretch to the ankle to help regain that upward movement of the foot. And down, okay? And again towards you, and hold. Probably again about a 15-second hold for these, maybe 4 or 5 reps in a go, okay? Again, slightly uncomfortable, possibly, but should not be excruciatingly sore. Okay, that's perfect. Well done. Okay. Other exercises that we would ask you to do as soon as possible after ankle injury are basic balance exercises. So if we can get you up to stand. Over here, okay? If you can pop your hands against the wall, okay? And what we would maybe start with initially is some basic weight shifts, just shifting your weight from side to side, or going from leg to leg, or eventually just standing on the affected leg, trying to balance, trying to do that with little assistance from your hands, or eventually no assistance from your hands. Maybe using your tummy muscles and the muscles around your bottom to help you balance. Head up as well, Kevin. Good man. Okay. Once you've progressed that, come on over, Kevin. Okay, you can move away from the wall, and you can start to be much more dynamic with your movements. Okay, so things like this, again, challenge your balance. Good, very good. Well done. As a result of ankle sprain, walking pattern is obviously affected. You'll typically find patients walking on their toes with a marked limb, or walking with a flat foot pattern, not allowing their knee or their foot to bend. In physiotherapy, we try and encourage our patients to walk as normally as possible after ankle sprain. The ideal is to get a shoe onto the foot as soon as possible. And when you're walking, trying to allow your foot to roll from your heel and onto your toes as soon as possible after ankle sprain. It is recognised that this probably will be slightly uncomfortable, but the sooner you can adopt this pattern, the better, as it helps with movement and stiffness at your ankle and general return to normal function. In regards to ankle sprains, the frequently asked questions include: when can I return to work, when can I return to sport, and when can I drive? Firstly, in regard to work, If your job is sedentary, we spend most of the day sitting, early return is encouraged. However, one shouldn't be sitting for too long at a time, otherwise the ankle itself may stiffen up and be uncomfortable when you start walking again. If your job involves you working on uneven ground, you would have to make sure that your walking pattern is at a decent level. This also includes if you're climbing in and out of high equipment or machinery, including lorries. It also means that you need to be safe, for example, if you're going up and down ladders. So those are things that you would have to consider before return to work. In terms of driving, you have to be able to produce an emergency manoeuvre, for example, an emergency stop safely before you're allowed to be driving on the road. It isn't permissible for you to be driving with, for example, air boots or other aids after injury. We expect full recovery from your ankle sprain by about 6 weeks after injury. However, it can be an injury that can recur if you do not adhere to the exercise regime that we have shown you. And we would recommend adhering to this program for about 3 months after initial injury. If you feel your symptoms are not progressing, in other words, your walking isn't improving, you're having difficulty with movement and pain isn't settling, we would encourage you to liaise with a chartered physiotherapist or with your own doctor. Okay. In the case of walking and not being able to weight bear effectively within 10 days of injury, certainly a return to A&E would be encouraged. Thank you very much for watching our video. Hopefully you found this useful. If you have any feedback, please don't hesitate to leave some comments below.